Okay, so this will be our first lecture, or first introduction to the concept of what preoperative care and postoperative care. Now we'll discuss it briefly, but before we go in, I'll just like us to play around trying to define the words. Okay, so when you say something is pre, is before. So before an operation or a surgery, do you understand? When you say something is post, is after. Okay, so after an operation surgery. So all of them is just all around the type of cares you give to a patient, okay, at these critical times, right? So preoperative care, we said that this phase prefers you are trying to prepare the patient physically and psychologically for a surgery that is going to take place. So you are preparing them because you want to minimize any risks and you want to make sure that the outcome is superb. Okay, then first of all, you access them, you take their medical history, you do physical examination, you do all the necessary laboratory tests, you do imagings, everything you are trying to document and be 100% sure that this surgery I'm going in, of course, it will be effective. You understand? Then you stratify their risk, okay, all those prognosis. Patient optimizations is if they have any chronic conditions, you have to be treating that chronic condition at that time. Okay, nutritional support if the patient is malnourished. If they smoke or take alcohol, they have to take it within that time being. Okay, then some drugs that you want to be given as prophylaxis, like you want to go into the surgery, there's a risk of infection, so you start giving antibiotics already. Okay, the psychological support is you counsel them about everything and make everything user friendly to them. Okay, reduce their anxiety. Okay, get their informed consent. They have to agree to you doing that. Okay, physical preparation is fasting guidelines, bowel preparation if required, skin preparation, venous access, securement. Then post-operate, everything we spoke about here was before the operation. So after the operation, we said that this phase you have already done the surgery, so you are focusing on how the patient is recovering, and you want to also prevent any complications that this patient is likely to have. Okay, so immediate post-operative is you are always checking their vital signs, their airway patency and breathings. You're always checking about their consciousness level. You're always trying to access the pain and also manage the pain. Now, early post-operative care is fluid and electrolyte balance, wound care, drain and catheter management. You try to make sure that the patient is moving around so that they don't have deep vein thrombosis as a result of bed reading. Then nutrition. So complication preparation, so infection control, thromboprophylaxis, respiratory exercise. You keep monitoring the patient. The rehabilitation and discharge planning is you control their pain, physiotherapy, okay, educate the patient, then always write them up for follow-up appointments till they 100% recover.